Hi, I'm Bob Sanborn, President and CEO of Children at Risk. Childhood poverty is one of the biggest obstacles to the success of a child anywhere in the United States. Here in Houston and Harris County, 47% of our children live at or near the poverty level, and 24% of those children are indeed growing up in abject poverty.
Well, in Houston and Harris County, on any given night, meaning that if you were to go out on a Wednesday or today for that matter, and just did a count of people who are homeless, that are those individuals who are living on the streets, sleeping in their car, under bridges, or living in emergency shelter or transitional housing, that number would be 10,000 plus, men, women, and children. About 20% of those that are homeless are in a family situation. The majority of those individuals in that family structure are children. So, you know, you're talking roughly, and it's just very rough, about 75 or 80% within that 20% family structure are children. Studies were done in terms of homelessness among children. And they studied what is called the traumatic effect of homelessness on children. And they compared it to a soldier who experiences post-traumatic stress in combat. That's the same effect homelessness has on a child. It is pretty traumatic. It causes different types of mental and physical reactions in that child. Generally, a child who experiences homelessness has more behavioral problems because they're going through a traumatic experience. They're more likely to be held back in school because of the moving around, etc. They're also more likely to begin to become more developmentally delayed because they're not in a stable environment to help with their growth and development.
Is y equals -3 sine of...
We know that children have to have a certain number of words before they enter kindergarten. If they do not have those words, research has proven they will not graduate from high school and they can never catch up. And when you're at Maslow's hierarchy of needs and you're on the basic level where you're needing shelter, food, clothing, the basic needs, your verbal skills and the time to interact with your child is not always the best.
The poverty level in 2008 was $21,000 for a family of 4. Near poverty, which is double, is $42,000 for a family of 4. Medicaid is available for children and families that live in poverty, but the Children's Health Insurance Program is available for families that live up to the 200% level near poverty. But what we're finding out is that even though families are doing everything that's right, they have a 2-parent income, they're working, you know, in a family 2 to 4 jobs to support, and they barely get over the near poverty eligibility, they're unable to afford health coverage. So it's extremely important for our children to be healthy. A significant part of that is making sure that our kids have health coverage and have access to health care. People need to realize that unhealthy children is an unproductive workforce, is an unhealthy future.
We know 0 to 5 is it now. 0 to 5 is it. And research has proven that if we can make the difference and have children ready at 0 to 5, there's less crime, there's less teen pregnancy that graduate from high school. I believe that the community is becoming more aware of children's needs. You have several initiatives, but I still don't think there's enough yet. There won't be enough until we can say that all children have health care. Not one child goes hungry in this country tonight, and that we are getting them ready for their future. And we still have some ways to go.
When a child grows up in poverty, it means they're going to have many more obstacles in front of them before they're able to succeed. That means they're much more likely to end up needing health services. These are children that are much more likely to drop out of high school. Childhood poverty is something that we need to end. For more information on these issues, please visit us at our website at childrenatrisk.org.